To heal the leaky gut, we want to take some herbals that will support it. We want to change the diet. If we have a good count of bacteria inside our gut that's hiding or that's supporting it, then these other invading life forms cannot invade. The nutrients that we're digesting have to get through, but they're designed only to be certain large, certain amount, certain size.
Right.
But now we open it to be this big, and what's interesting is most of us carry it, we don't even know it.
Welcome to Salus Health Topics. Today's discussion with Dr. Troy Giles focuses on the subject of leaky gut syndrome, what it is, how it happens, and what we can do.
Okay, so we've got a broad variety of subject matters to cover, and one of the subjects that seems to be at the root or the core of health is the digestive tract and how that relates to leaky gut. So maybe if you want to kind of tell us a little bit about what leaky gut syndrome is and how it can affect other elements of health throughout the body.
I've been practicing now 28 years, and just about a year and a half into practice, I was introduced to the idea of leaky gut. And back then, nobody was talking about leaky gut. It wasn't a big deal. And now everybody is. Oh, that's the microbiome, the small life forms that are within our gut. Now is the big buzzword. But I noticed as I started to bring that into the practice and started to treat leaky gut, that other issues cleared up as well, very, very nicely.
Okay.
So here's what I'm talking about. Leaky gut is in our gut, it's usually a semi-permeable membrane. I'm looking at you and I can see you through that little hole. When it becomes too permeable, it becomes large. These fissures and holes become larger and allow things through the gut that shouldn't be there. Mm-hmm. So that's the idea. We want to be able to support the gut, get it to come back to a normal semi-permeable membrane. And then other inflammatory states that have been created by things leaking through the gut now can be diminished, and those things will diminish right out.
Yeah, you gave an example off camera there of, say, a larger protein passing through the guts and the body attacking it.
Just looking at these two pens here saying, okay, this is a great example. This would be a protein that would get through that leaky gut that shouldn't, it's too long. Let's say just this black part should be getting through. But because it's a longer chain protein that's not digested well, for example, it's able to sneak through that hole. As it comes through, the body sends antibodies to anything that it recognizes as foreign. So this is a foreign protein. Mm-hmm. Antibodies attack it, and when they attack it, it starts to become what's called an antigen-antibody complex. Mm-hmm. Antigens are abnormal. So now we've got this complex floating around, and it can get stuck in tissues, it can get stuck in joint capsules, creating arthritis into the tissues, creating whatever inflammatory state within that organ. Now the other issue that we talked about is the idea of autoimmune issue. Mm-hmm. This complex now, once the antibodies attack it, they have a remembrance. So now anytime anything looks like this coming through the gut, it's going to attack it, but it also looks around the body to see what else there might be that's similar to this. It's scavenging, looking for anything else, any other invader. And this happens to be looking, oh, that's quite similar to it. Black tops, white bottoms. So now the antibodies are going to say, okay, I'm going to attack this as well.
And this would be something that's within your body already.
That's you. This could be pancreas. This could be thyroid. Now we have inflammatory thyroiditis. Now we've got diabetes in our pancreas. Autoimmune issue. Mm-hmm. There's predisposition to autoimmune as far as genetically as well, but those genetic prefactors do not have to demonstrate. It's usually when the body becomes weaker and weaker that the unhealthy demonstration takes place.
The leaky gut syndrome happens within that digestive tract. Why? What's going on? What's creating those abilities for things to get outside of the gut wall?
As you were talking, what came to my mind there that I wanted to discuss is your oils in your skin. See, we actually have a oil-based protective layer on our skin. Our microbiome, micro means small, biome or life, so small bacteria within our gut are also fat soluble. Fat, oil.
Okay.
So the microbiome are also fat soluble, just like our skin protection. So the microbiome, which we'll cover in another video, we can go really dig down deep into what the microbiome is. That's the protective nature within our gut. So I like to discuss our gut, our alimentary canal, our digestive tract, as a donut. Think about a donut and the hole within the donut. On one side, that would be the mouth. On the other side of the donut would be the anus. That is opened to the external environment. So you literally have things like drinking water or eating food. It's all part of the external environment. It's got to get through the inside of that donut into the bread of the donut before it's actually inside the body. It's got to make it through this semi-permeable membrane. The nutrients that we're digesting have to get through, but they're designed only to be certain large, certain amount, certain size.
Right.
But now we open it to be this big. Now we got this leaking through. Now we got that attacking the body.
Right. So it's it's incorrect to think that something in your stomach is inside your body. It's still somewhat external to your body because your digestive tract has to pull it into your bloodstream, and so that you're using the nutrients and the energy of that food source correctly.
Yep. So you ask, and I didn't quite finish that, why do we get a leak? What creates that? It can be anything from what we're eating, bad foods, preservatives, chemical-laden preservative foods, meat that's feedlot meat that's got chemicals and growth hormones and antibiotics, to layers of infection. Now, so it's a myriad of different things. When I say layers of infection, I'm talking about fungus, bacteria, parasites. Usually are the things that can get in. And let's say that this is the membrane, my hand, my fingers. As those offending organisms start to attack, they can penetrate down into that colon, and now you've got a problem. You've got a weed in your grass. That microbiome, those good bacteria that are protecting you, are almost like the grass in your lawn. So whenever there's grass that starts to become thin and attacked by whatever, maybe there's chemicals that aren't good for it.
Sure.
So it starts to die off and create space for weeds to take hold. Same kind of concept. If we have a good count of bacteria inside our gut that's hiding or that's supporting it, then these other invading life forms cannot invade, because the good bacteria are protecting it, keeping the actual meat, the actual tissue covered with a good count of bacteria.
Okay, so to be clear then, what is creating the holes in that protective layer or the microbiome that coats the inside of your intestinal tract?
Yeah, so that would be the infestations, inflammation from the infestations of those small particulates. And what's interesting is most of us carry it and we don't even know it. Now we can do a complete digestive stool analysis where we take your stool and look at it and say, okay, yeah, we see fungus and we see a parasite and whatever. But generally speaking, when they do those tests, they don't give the patient a laxative first that will knock stuff out so that they can see it.
Okay.
So many times those come back, oh, there's no problem here. You don't have any of those issues.
Okay.
You don't have them because they're alive, they're on.
So now, so you can take, when you eat things, you can take things that are going to damage the microbiome layer.
Alcohol.
Alcohol.
That's a big one. Alcohol, pesticides, not pesticides, but herbicides. We've talked about Roundup.
Okay.
So Roundup doesn't affect tissues of our body as much as the microbiome. Bam, it's really wiped out by that.
Right, and that's because the Roundup uses a different channel to communicate, and so the cells of our body aren't damaged, but yet the microbiome, which is integral to the health of our body, uses those same channels because it's more plant-based organisms that are separate from us. Okay.
Correct. Antibiotics. Antibiotics will wipe clear the good bacteria.
Big grenade in the stomach area there, yeah.
So the antibiotics will kill indiscriminately water-soluble, fat-soluble, whatever. So as we start talking about treatment of this, with silver, it only affects water-soluble bacteria, so fungus and parasite.
Okay. So one of the fundamentals of health or healthy finances, whatever it is to remove the conditions of failure first and then stack on the conditions of success. So if your microbiome is out of balance and you've got negative fungus and bacteria going on, you're not going to be able to have the right digestive process, and that's going to end up in a whole bunch of other symptoms that get classified as diseases and so on.
Correct. So when we're talking about when the microbiome goes down, or when there's a fire, inflammation in the gut because of these unhealthy foods and pesticides and blah, 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 and antibiotics, and now you've got inflammation and you've got layers of infection, and those are, it's all just nasty. It's a jungle. Instead of being a lawn, it's a jungle there. We've got to now shut the fire off first. So if we're talking about basically the 4 concepts of how to heal leaky gut, heal the trunk that ultimately leads to that disease, or that disease on the tree, and that leaf over here on the tree, we go back to the trunk. The 4 concepts are to heal the leaky gut. We want to take some herbals that will support it. We want to change the diet. Okay, we want to support this. That's the first step. Secondly, we want to rake and get rid of those infective issues. Rake them out of our lawn. Third, we want to replenish digestive enzyme, because mainly a lot of people are diminished in their digestive enzyme. Amylase, protease, lipase. Amylase is carbs, protease is protein, lipase is fat. So when you have the appropriate amount of digestive enzyme, you can digest your food enough so that the thicker things that shouldn't be getting through now are digested enough to where they can actually be absorbed.
Okay. So smaller pieces, you're breaking down
Smaller
the pieces.
Yep.
And it's okay if smaller pieces are getting through the gut. You want them in there. But the bigger pieces are going to create infections or allergies or inflammation because the body ends up attacking them.
Yeah.
Okay.
And then the last one is to reseed the lawn with good bacteria. And there's some specific good bacteria. It's not just Acidophilus and bifidus. There's very specific good bacteria that need to be replenished into the gut. So if you take an antibiotic, you need to reestablish that lawn. You need to, because you're going to blow away the lawn. Sometimes it's needed. Sometimes you're extremely, you're in the hospital with massive pneumonia. Give me the biggest antibiotic you've got. Make sure it's the right one for the right bacteria. Give me silver. Give me gallons of it. Because if I'm going to die, I want a lot of silver. I want as much as I can do to fight it. Later, then, let's go back and repair the microbiome. Let's get good bacteria reestablished, the appropriate good bacteria.
Right.
And Salus will be having that soon, where people can order, once they use the silver to clear it out, to clear the infections out, then they can reseed with a good acidophilus, good microbiome.
Okay. So leaky gut is at the core of a whole bunch of ailments, and if you can deal with that a little bit, now you can start to shut down some of the other symptoms that might be going on. And we're going to talk about that in a whole host of other videos.
I want to make the distinction why, just real quickly, how that happens. Because do you remember the antigen-antibody complexes? That creates inflammation. It creates an overall inflammatory state in your body. If everything is now, you've got overall inflammation through the system, now your thyroid's a bit inflamed, your brain's a bit inflamed, your joints are a bit inflamed. Now there's
foggy, you're not thinking right.
Other infections can now get into those joints and start to work it down, or start to work the pancreas, and now it starts to get into diabetes, and then at some point it turns into diabetic cancer. I mean, at what point from cancer to eating the wrong food does it turn into cancer along the inflammatory state?
Right, so we're talking about a threshold of negative digestive process.
And I'm going to look at the camera here because I want to talk to you. So I want to talk to you who's watching this right now. Please look at your gut health. Get your gut health set, because it's going to help you so much more in all of those other infections that we'll be discussing. Look at the other videos and you can understand a little bit more. But I just want to look at there in the eye, because I do it with my patients. I look them in the eye and say, this is where we've got to go. Please feel it, understand it, absorb this information so that you can be empowered to take control of your health.
Excellent. And let's wrap up with that, and people can check out some of the other videos on more specific subject matters or ailments that they're dealing with. And thank you very much.
You bet.
Hello, Internet! Thank you for watching our video on leaky gut syndrome. We're very grateful that you did. It's our intention to give you foundational information so that you can better formulate questions and therefore get better answers about how to manage your health and wellness. If you thought this video was valuable, please share it and or like it or subscribe or leave comments below or whatever it is that you feel like you want to do. In the meantime, check out some of our other content either here on our YouTube page or on our home site, salusdefensestructuredsilver.com. Cheers to your good health. We'll see you next time.